kind of an interesting pivot, but you just gave a lecture about semen analysis and how that can be kind of tied to metabolic health. Where is the utility in what we do for using that or tracking that data?
Yeah, I think again, it would be a really cool way to have a biomarker for mitochondrial function and for redox balance in the body. Right now, we have sort of surrogate ways of looking at that, right? So when it comes to redox balance, we can kind of look at inflammatory factors, but we still don't entirely know where the balance is. And similarly for mitochondrial function, you can measure a VO2 max, right? So in an exercise test, but that has part of that as your mitochondrial function, but it also includes your heart and lung function. So there's so many other variables that are also rolled into that. It's not specific for your mitochondrial function, but something like a semen analysis, if you're looking at things and you're saying, oh gosh, these sperm cells, they're not moving at all. I mean, that's going to be a mitochondrial issue right there.
Is there something equivalent for women that tied to fertility? I mean, you could maybe think of predictable ovulation maybe in that space? I don't know, anything come to mind?
I haven't actually thought about a similar analogous test in the women's health world. Because we can look at things like anti-Mullerian hormone to look at ovarian reserve, but it's really not the same as being able to look, like I guess you could extract an egg, right? But that's a little bit more invasive. You can't easily get at an ooze site from a woman, right? That's a much more involved process. Yeah. So I don't know. It's a good question, though.
Yeah, I would think at least it's not a direct biomarker, but roughly, predictably, regularly ovulating would be a sign that, a lot of things are firing on all cylinders. Yeah. So kind of a more generic question, but I thought it would be interesting if we just kind of talk about the different demographics of people and then just a very general framework of how you would, in terms of their hormones, be thinking about things to look at or questions to ask them. So in general, what would be your approach to hormones and health optimization for, let's say, a young man, let's say somebody in their 20s, early 30s, they're coming with some of the typical complaints of maybe feeling more fatigued, brain fog, things like that?
Yeah, I think in a lot of those instances, when young men have those symptoms, there tends to be a lot of pretty easy things to go after. They tend to have obvious vitamin deficiencies, and their diet and lifestyle oftentimes is not the best, and so there's a lot to work with there. They haven't had the chance to implement a lot of these healthier patterns for any substantial period of time, so that's always a long runway before you think about doing anything more involving types of HRT in that population. So a lot of investigative work, I think, in that, like we just mentioned. I think the semen analysis would be interesting to see in a younger person, because you can start to gauge, hey, looks like you've probably got a lot of your mitochondria don't look like they're too healthy. We should really think about that and why that is, and help you get that better. So
what about a young woman in 20s, early 30s, maybe some similar stuff, low energy, brain fog, not feeling like themselves?
Yeah, I'd say a lot of similar things for the young man. Exactly. I think sometimes that if women are in certain states where they're not ovulating as efficiently, then you can potentially bolster that without really causing any longer term impacts, right? So progesterone, for instance, is very safe. It can help women that maybe have some, like I said, inefficient ovulation, that don't have enough, because we know how protective the progesterone is for things like uterine cancer and breast cancer. And so I think I would look at those pretty carefully. No equivocal test, though, to the semen analysis right now. Yep.
What about an older man? So let's say 50s, 60s, things are changing, they're not feeling like themselves, energy's low.
Yeah, so
testosterone is probably near the top of the list there of things to be thinking about.
Sure. In older individuals, you want to know, okay, a lot of the history here. What have they done before? What have they tried? How much of this is just more of a primary hypogonadal issue versus more of a signaling secondary hypogonadal issue? And is there any other levers that we can pull, or is TRT clearly the testes have essentially gone kaput? He's not going to make adequate levels on his own to feel the way he should. So that could be a little bit more of a direct pathway to intervening on the hormones, for sure. And oftentimes in the older individuals, that fertility is not as much of a concern. So
now for women, I would split that into maybe two categories. So somebody who's maybe in perimenopause, and then a woman who's maybe postmenopausal.
I think the main difference for me when it comes to perimenopause versus true postmenopausal is just the being a little bit careful with estrogen when it comes to the perimenopausal woman, because there can still be occasional fluctuations in levels, and if you have that woman on some form of estrogen that you're giving her, you can potentially make those effects worse from the excessive estrogen. So I just like to be careful in those cases. Now, if somebody is pretty overtly symptomatic and it's clear that they're estrogen deficient, even though they maybe had their last menstrual cycle was 7 months ago, I don't think you need to wait 12 months to start estrogen, but just some things I think about.
Yeah, yeah. But all categories across the board, I mean, thinking about sleep, thinking about exercise, all those foundational things for sure.
Goes without saying, yeah.
What are the most common contributors to low testosterone, in your opinion?
It's a little bit hard to know. It's kind of like a multivariate equation. You have so many different things in there. Which one is going to have the heaviest weight, right? Which variable? Is it going to be the underlying genetics? Is it going to be certain vitamin D deficiencies? Is it going to be they don't really do any resistance training? They're kind of more the sedentary side of things. Is it there's some kind of a psychological component to it, meaning maybe they've been somebody that feels more or less like they have to be kind of take a back seat and be more of an inferior type role, So I think there's, and then drugs, right? So certain medications that they might be on. I'm sure there's more that I'm probably missing, but
I think sleep is a huge one.
Yeah.
I think sleep is a huge one.
Yeah, well, I mean, how often do you see shift workers that come in that work night shifts and have optimal testosterone levels? It's almost never that happens.
That's actually an interesting point about shift work, because I feel like we see a lot of people working shift work, and the conversation that I'll have with them a lot of times is we can control some of the things in our life and we can't control some of the things in our life. Like sometimes they just have to work shift work. What other important considerations for people who have to, maybe that's what they have to do for their way of living, do you talk about with them?
I try to say to make sure that they're looking at it as a short-term thing. Like this is probably not good for you to do this for 10, 20, 30 years. But in a lot of careers, like nursing, you kind of got to put in your dues and do the night shift well. Or same thing when you're a
I got away with never having to work a night shift as a nurse.
Unbelievably lucky that you did that. But that's not typical.
No.
So I think that once they understand that, yes, this is something that is detrimental to your health, it's playing a big part, and I think that a lot of people don't necessarily know that. I think everyone in the healthcare field kind of knows it. That's why when you go in the hospital, there's not a lot of older nurses working night shifts anymore. Yeah. Because they all understand that. Yeah.
Isn't shift work now classified as a carcinogen? Is that true?
I think I have heard something to that effect, yes. Yeah. Which wouldn't surprise me. I think that I mentioned earlier today these clock genes that we have, these clock genes that are very important for turning on other pathways that are antioxidative, also help prevent cancers, those things that, and these clock genes are all influenced by having a healthy circadian rhythm. So if your pineal gland and melatonin pathways aren't working right, a lot of things are going to break down downstream of that. Yeah.
Going back to low testosterone, what is one important thing that you think people forget about before jumping on testosterone?
I think there's a lot of awareness now about their concerns about fertility. I think very rarely does somebody come in and say, oh, I didn't realize that it would do this. I think I did see 4 or 5 years ago, it was different. I think you would see a lot of people that went to a brick and mortar clinic and got started and didn't realize that, I now do not make any sperm. I didn't know that would happen.
Yeah.
So I guess probably now one of the prevailing misconceptions that are still out there, I think people still come in a lot thinking that, I need to do things to lower my estrogen. I need to do things I need to get my blood, give a therapeutic blood donation every so often. I think a lot of people still come in thinking that. If
you benefited from this conversation and want to learn more, feel free to check us out at marekhealth.com, where you can connect with our team and we can go more in depth with you.